We thought that if we can design a product using the same technique as the fusion, same surgical technique, but restoring mobility of your neck and potentially protect the adjacent level from degeneration, we thought that this can be a great idea.
My name is Thierry Dufour, neurosurgeon from Orleans in France, and I have implanted the first ever Mobi-C in 2004. So we worked for 2-3 years on the first Mobi-C device, and I was the first. Just 2 days before the second, but I was the first to implant the Mobi-C in a patient. I can remember that very well.
I first heard about the Mobi-C study about 8 years ago. This was a device that was, he thought was going to be revolutionary as far as treatment of cervical disc disease for patients, and I think in the end it has been.
One of the most exciting things about the fact that we had a two-level arm to this study is that it really gives us real data on what does a two-level do.
I think that as a orthopedist who is very much concerned about function of the human body, you can say we are restoring function rather than limiting function, mimicking and restoring the human body to as close to its natural state as possible. And so a disc arthroplasty does that much better than fusion.
When data is equivocal, you can play all sorts of games in your mind about how that's going to work out. But when you get superior data, and it's class 1 data, and it's just compelling at that point that a doctor has to go, gee, if it were me and I had this problem, what would I choose?
In our area in Southern California, patients are pretty well informed, and they've heard about fusions, they've heard about disc replacements, and a lot of patients will actually come to us to look for disc replacement.
We have superiority on the clinical outcomes, and we have a significant difference in the reoperation rate between ACDF and total disc replacement is really quite compelling.
You can talk to surgeons, and when you're discussing with them a two-level procedure, fusion versus arthroplasty, and they can say, I have great results with a two-level fusion, you can say you will get superior results with a two-level arthroplasty in the properly selected patients, and this study proves that.
I think the results from the 24-month and 48-month follow-up are pretty remarkable, especially with the two-level. We've seen that the one level is proven to be just as effective as a disc fusion, and with the two-level disc replacement, really the results are superior to fusion, with a lot less need for revision, less need for reoperation, improved mobility, and really improved outcomes.
And this is really cutting-edge technology. So to get this recognition that the Mobi-C actually is superior for two-level implants versus two-level fusion is very, very exciting, and great news for the patients and the physicians that are going to present this device to the patients.
It's a proud feeling that this idea was a good idea, finally. And you can make a very, very impressive study comparing one level, two levels. So this is very good job, very good job.